Welcome to Clifton Health on Air. I'm your host, Crystal.
And I'm your co-host, Lauren.
We are a local health department podcast in Clifton, New Jersey, also servicing the township of Little Falls.
We are located 12 miles west of New York City.
And today we're celebrating Hispanic Heritage Month by having a conversation with a Latina in healthcare. We'll be diving into her personal and professional experience as a registered nurse with her master's in hospital administration. So welcome, Luisa. It's an honor to have you.
Thank you guys for having me. Thank you. Gracias.
All right. So let's just dive right in. Hispanic Heritage Month spans from September 15th until October 15th. So, do you feel comfortable sharing a little bit about your cultural background and what Hispanic Heritage Month means to you?
Okay, so raised. I was born in Dominican Republic. My parents are both Dominicans. I'm I think the second generation here. I come from a family. My parents are, you know, physicians and all that. So healthcare was like innate for us. I did my first bachelor actually back in DR. I graduated, I think, 2007, and after that, I returned to New York, trying to figure it out what was next. I started working in a pain management clinic for a private doctor, and that's when at the same time, I started doing my master in Spain. It was part of it was on online, and then I was supposed to flew back to Spain, but I didn't. Got too crazy. The master was like, what am I gonna do? Like a where am I going? But I always wanted to have something under my pocket, that if my plan wasn't clear, that could be, a work or like an employment area. Um, After that, I think I worked for another 2 years, and then COVID hit. I had my first baby at that time, and next year I had another baby, and that's when I went crazy and said, okay, I already had a bachelor in science. I'm already, healthcare has been something that I'm that I'm, interested in. Let me go ahead and do an accelerated program for nursing. It was crazy. My baby was 3 months when I got accepted, and I was like, I said, take it or leave it. I think it's something that I've seen on fellows Latinos and immigrants that we really don't think too much, because if we do, then we kind of backed up and we are like, oh my God, is this a good idea? I just took it. And once I graduated, I was like, I was really demented. This is, two little kids just
Yeah.
coming back, it was like a lot. But I had support, and that always helped. To people, it's a surprise that I'm Hispanic or Latina, because I'm Black, and people was like, "What?" And I'm like, "Yeah, it's just you can be both. Like you can be both." But it's always fun. It's always fun. I think I'm definitely know healthcare is my passion, helping people, um, especially Hispanics, because there is a lot of needs for people that actually speak your language when you go to seek or when you need help, especially when it comes to healthcare, especially when it comes to your health.
Oh, that's awesome. And so true, I'm sure. And I wanted to kind of touch a little bit more on that itself. So, that experience that you're sharing about, as a Latinx individual or a Hispanic person coming to a healthcare facility and seeking services, but not feeling quite comfortable. Can you tell us a bit about that type of experience, maybe on both sides of the coin?
Yeah. So it is always, I think, precious to see how, people need help, but we have a lot of cultural reasons why we don't speak or we don't ask for help. So it is a sign of relief for them when they know somebody speaks their language. And it's a sign of release for them, because they are able to express things that, because they don't have the language, because they don't speak English fluently, or they don't understand, or they don't speak at all, they can actually comment their real concerns, and it could be a more realistic and more, you can get more benefits within the relation. Then on my end as a patient, it is sometimes I see that you really, if I have to stand my grounds and I'm fluent, I can not imagine somebody that is not fluent. You know, if I have to advocate for me and I'm fluent and I know what I'm talking about, I can, you know, I get on the shoes of those who cannot. And this is why I choose this. This is why I choose being like in the ground, like actually working with underserved community. Like I currently work in Patterson. So, you know, people that need us, because when they go to the hospital, either they talk to a machines or they don't talk at all.
Mm.
And it's you know, if you're not, I always say, like, if you are not part of the community, you kind of don't understand. And there's this little stuff, especially for us Dominicans, little words that they have a special meaning. And when you tell me, I know what you're talking about. When you tell to another provider, it's like you're talking out of like you're crazy, and it's like no, it's a normal thing for us to say this and that, or you know. So it is always important. I always tell the patients, that's my go-to. You have to talk, you have to say what you feel. You, nothing, it's normal. Even if they're tired and you already told them, tell them again, tell them
Mhm.
again, tell them again, until you find someone that can help you. Because if you're concerned about it, we should be concerned about it as your healthcare team.
Mm. Oh, that's so powerful. And I can tell how passionate you really are about this work. So, again, thank you so much for having this conversation with us. Um, so, can you talk to us a little bit more about maybe some unique challenges and advantages you might have faced in your career?
I think challenges is the getting in the door. Like I always tell people, like, yeah, I went to school, yeah, I graduated, but people only see until I talk, and they see that, okay, it seems like she might know what she's talking about. It seems like from the get-go I have a uphill battle to actually go into certain places or obtain certain stuff, because people don't know who I am, and they just see, oh, this is another girl. And do you really, I have people tell me, oh, your English is really pretty, and I'm like, mm, I'm not sure how to take that, but okay. You know, because there's some small stuff that people say that to them might be normal, but to me, when I go home, it's like, oh my God, that was not cool. And the advantage is the fact that I can communicate with both. I can fluently be on a spaces and move without feeling like I don't know what I'm doing. Because you have to learn a lot about cultures in healthcare, and being from another culture gives you that okay, I have to learn everybody, and I have to be able to identify it at some level with all of my patients, even if it's a little bit. You know, it's always like I always ask them, where are you from? And I try to get in my head from geographic class something particular to that place, so we can build our rapport from that, and then move on from there on our, you know, on our relationship, in order to that it could be beneficial for them as a patient and for me as a, you know, a healthcare worker.
Definitely. And I can imagine that taking that step makes them feel more comfortable, one,
Oh
sharing
yeah.
any of their symptoms that they might not have,
Yeah.
felt as comfortable sharing. And that helps you to be a better provider
Yeah.
for them and advocate for them as well.
Completely. I think it's a, I always tell younger people, like, you need to learn at least one dish from every country that you hear, or at least the type of music that, like, something, because people in healthcare already comes with concerns. So you have to give them a breeze. I always try to, you know, tell them something like, where are you from? Oh, I'm Puerto Rican. Okay, so let's talk about salsa. And I mentioned something that is gonna open the window of, okay, I know this is serious, but let me talk about something else that is good to you, that it does good to you. Because healthcare is too sad, and it's a lot.
Could you expand on what you've learned about different Latinos? Because I think that oftentimes people think of Latinos as a monolith. And you already mentioned about being a Black presenting Latina, how that already gives you a different experience, a unique experience, and that people question your Latinidad.
I think the first thing is that I could never get tired of saying, yes, I'm Dominican. I know Spanish. This is not that I learned. I was educated in Spanish because people would tell me, ay, Dios mío, qué bonito tú hablas español. Y yo, es que yo como plátano. Yo crecí comiendo plátano. So, so I would tell people and they get embarrassed because they're like, oh my God. And at this point, it's like, it's okay. It's fine. But you see, I feel it's like it has a lot to do with what is portrayed to people of communities. So I think I'm a regular Dominican because I speak like 200 words per minute.
Yeah.
And that is, and I tell people, like you can tell I'm because I speak really fast. But then you see Boricuas being really proud of their island. I always tell people you are never gonna meet a Boricua who's not proud of their island. You're gonna tell they're Boricua from a mile ahead because they are proud of their island. And then you see Mexicans being really reserved, or Central American, and when they come in, they're really reserved and they would tell you, si señora, no señora. Like there's certain stuff that as soon as you meet them, you're like, oh yeah. And my provider, my boss, she would be like, oh, but I thought it was meant. One anecdote. We have a Colombian patient who said, oh, yo traje mi bolsa. And the doctor is like, what? La bolsa, las cosas están en la bolsa. Y And the doctor comes out and she's like, Luisa, she keeps talking about a bag, but she has no plastic bag in her. I'm like, so she has a purse. Yes, she does. And I'm like, that's what she means. It's her purse. She's like, pero isn't it cartera? And I'm like, yeah, it's also cartera. Like there is words that we use to describe the same thing that to other is like, oh my God. And it's funny to me. I always laugh because to other it's like, oh my God. And it's like, it's normal. It's a little nuance. It's a little regional stuff that every country has. And that you're supposed to learn or at least have an idea, because you're giving them services and you want to be able to communicate correctly.
That's great. And I wanted to take the moment to encourage anyone that's listening to have a conversation or learn about a different country, a different culture in this Hispanic Heritage Month. But in general, I think this season is about celebrating and uplifting and learning more about the Hispanic community. So thank you so much. I just wanted to kind of close off by asking if there's any message that you wanted to share about local resources or just any Hispanic community resources.
I think for young people is that we need more Hispanic, Latinos, other communities within healthcare. The population growing, the population that I'm serving, it's getting bigger. We having people are, the lifespan it's increasing, and we need more people that can communicate outside of English because unfortunately, not everybody. Like my grandma never learned English, so that is something that we see really often. And to our community, you have to talk when you go to the doctor. Bring a list, bring somebody with you, write down all your medication, write down everything that has passed from the last month that you see your doctor and talk to them. Their job is to listen to you, because if you don't talk, they don't know what's going on at home and they only see you for what, 20, 30 minutes. And then you go back home, a lot of things are happening. And when you come back, you only say, oh, sí, señor. Ah, sí, me estoy tomando la medicina. And there's always more to that. So speak up, because if you don't talk, we can't help you. I mean, I could have an idea of what you might not be telling me, but I can help you if you don't talk.
Yeah.
That's my message. And I always tell everybody, and bring somebody with you, bring an uncle, bring someone younger than you, ideally, that can give us another perspective of what you're saying, because sometimes older patients forget or they're embarrassed to say certain stuff, but we need to know in order to help.
Oh, that's great. That's really good insight. And I'm sure that a lot of people here could benefit from listening to hearing that. So, I would also like to share a few resources. So, we are having an art exhibit, our art center, until October 25th, and that is in celebration of Hispanic Heritage Month. And the name of the exhibit is The Great Inca Road and its Cultural Heritage. And anyone that's listening and might be interested can call the Art Center at 973-472-5499. There is also another event at the Botany Satellite Office. It's the Behavior Management event. It's specifically called Guía con Confianza, Maneja con el Corazón. That translates to lead with confidence, manage with your heart. I just wanted to thank you again, Lisa, for joining us and sharing and being such a bright joy in this conversation. Thank you so much.
Thank you guys. And whenever you guys need me, just, you can know how to contact me. Thank you. And hopefully people can, if you're going to take anything from this conversation, is that we need you to speak out. We need you to speak out. Okay. And seek for help. There's always help. You guys are doing an amazing job doing the screening. Because we need that. Thank you.
Thank you.